Hi, I'm Mike Staebler, and this is Dr. Mike Belanger, and we're coming to you here from Yawgoo Valley ski area. The snow guns are blowing and opening days in a couple days. We're happy to team up with Yawgoo Valley, and we'd like to talk to you today a little bit about snowboard and ski injuries and how to prevent them. Unlike skiing, snowboards, the rider is directly connected to the board and can't disconnect. So the problem with that is the mechanics of the fall are such that you can't stabilize your fall like you can in skiing with your arms. So when you do fall, it tends to be a lot more accelerated, if you will. One of the problems we see in snowboarding are the upper extremity injuries. Actually, a lot more upper extremity injuries than in skiing. The more significant or most common area of injury is in the wrist, and of those are wrist fractures. So we generally recommend, and we've done studies at University Orthopedics looking at the biomechanics of wrist injuries and found that wrist guards actually do help to prevent the severity and even the incidence of injuries. So we do recommend wearing a wrist guard. This is a typical wrist guard here. We recommend ones that have both a plate on the palm side and one on the back side. They basically slide on. This is the wrong side, so we'll get the correct side. And they form a nice sandwich here between the top and bottom of the wrist, so when you do fall, it helps to absorb the shock. What I always do or recommend is you get a glove size a little bit bigger than you might normally, and it slides right over this and you almost don't even realize that you have it on. But a huge help. They're not going to prevent all injuries, but they certainly do help that deceleration of that force. And as I said, most injuries occur in the wrist, and most occur in beginners and even first-timers. So we recommend you wear these for lessons and when you're first starting out. But I've been doing it over 25 years, and I still wear them every time I go out. The other thing that's really important in both skiing and snowboarding that we see is head injuries. And actually, head injuries are the leading cause of death in these sports, so it's really important to wear helmets.
I think a helmet for skiing and snowboarding is great. They're warm, comfortable, they block the wind. Cuts out some of the peripheral noise around you. I find it enhances my enjoyment of my day outside to be in my helmet. I know it makes me safer and I think a little bit more confident coming down the hill.
There's been some question of the helmets leading to increased risk of neck injuries and also affecting peripheral vision, but they've actually done some studies that have shown that that's really not the case. The other thing that is more common in snowboarding rather than skiing is ankle injuries. We don't see it as much in skiing. In snowboarding, because you have a softer boot, a little bit more pliability to it, you can get ankle sprains, but more specifically there's something called the snowboarder's ankle, which is an injury which occurs if you're going up for a high jump and you come down hard or land hard on the backside of a mogul and you hyperflex the ankle. If you look at it on this model, what happens is you come down hard and the ankle bends way up like that, and you break a portion of the talus, which is this bone here that forms part of the ankle joint, something called the lateral process of the talus. It's right in here, and it can mimic a common ankle sprain, and it's something you have to look out for. And the only way to really diagnose is with a CAT scan rather than a plain x-ray, because that can miss it. And these can be debilitating injuries if not caught in time and not treated properly, because some of them need surgery. So that's something to be aware of if you do have an injury and you have pain on the outer side of your ankle. It's important to get in to see an orthopedic surgeon or someone who can adequately work that up and preferably get a CAT scan to make sure it's not that type of injury, because it is almost exclusive to snowboarding.
Shifting gears just a little bit, I'm going to talk about skiing. One of the things Mike was just talking about is the lateral process talus fracture, ankle injury that has to do with a softer boot. Skiing tends to have a harder boot that protects us a little bit more from ankle injuries, so we don't see quite as many ankle injuries, but more higher up the body where you're not protected in the boot. I think skiing is unique in that you can kind of hurt your entire body in a ski accident. We talked about helmets to protect your head. Upper extremity injuries usually come from falling onto the ground, landing on a hand or a wrist. A hand that gets stuck in the snow can hyperextend the elbow, can hyperextend the shoulder, leading to injuries to those spots. A landing on the shoulder or on the chest can injure the clavicle or the ribs. So common injuries that can be prevented by learning how to fall, falling cautiously, falling with arms in, falling onto your torso or to your side rather than onto an outstretched arm. So I think of skiing injuries as kind of two classes of injuries. There's injuries that happen from falls and collisions, and then there's injuries that happen without a fall. Some people call those equipment-related injuries. And the common factor of them typically is that the energy in the ski is what's creating the injury. The shape of a ski and the edge of the ski is what allows you to turn and carve and glide, but it also can accelerate and rotate the leg out from underneath you, causing injuries to the ligaments in the knee. You've heard of ACL injuries. It's kind of the dreaded ski injury, but also the other ligaments around the knee are sometimes hurt as well. The medial collateral ligament, the meniscus. The typical story that we hear is that skier got off center or was leaning back. The ski accelerated either in or out. There was a pop in the knee. One of the names for this phenomenon is called the phantom foot. And the thought is that the rear part of the ski, if the edge is weighted with the skier's weight back, the ski will suddenly accelerate, twisting the leg and tearing the ACL. The other major ski-induced ACL injury mechanism is if the skier lands on the tail of the ski, it drives the ski boot forward, bringing the skier's leg forward, tearing the ACL that way. I wanted to show you just a couple of thoughts on the binding. The current thinking is that possibly bindings will help to prevent lower extremity injuries in a couple of ways. The toe piece of the binding is what allows the boot to rotate out. So if you're twisting and your binding is set properly, it's going to release your boot before you injure your leg. The heel piece of the binding, its main job is to let the boot fall forward. If you're a skier falling forward and your rear heel piece is adjusted properly, it's going to release the boot before you're injured falling forward. I want to touch for just a minute on poles. Have an example of a standard pole with a strap. Many of the pole-related injuries that we see have to do with a hand that's in the strap, connected to the pole, falling onto the snow surface, plunging the thumb into the snow while you're moving, abruptly pulling the thumb out of place, injuring the ligaments on the side of the thumb. Some people call it a skier's thumb. If you're falling, I propose you let go of the pole so that that doesn't happen. Your thumb isn't trapped by the pole.
On that note, one of the things that I think both for skiing and snowboarding is recommend falling if you can without your fingers out, but in a more closed fist, because that helps absorb force as well. So it produces less energy, I guess, through the fracture site or through the joint.
A variation on that is if you're falling and you bring your arms in, it's going to prevent the wrist and the elbow and the shoulder from seeing all that force. And coming back a little bit to the science, there's been some video analysis research that suggests that if your hands are in front of you as opposed to behind you and you're falling, you're much less likely to hurt your ACL in that type of fall. Closing thought, we don't want you to get hurt.
Don't get hurt.
We want you to be out here having fun. If you're out here having fun, we get to be out here having fun. If you're in our office and we're working, then we're not out here having fun with you. So don't get hurt. Be out here having fun.
Get out there and shred it and have fun, but don't get hurt. We'll see you next time.